Great to have you on today's edition of Press Hour. Welcome to the program. On today's edition of Press Hour, we're going to discuss the most topical issue of the day, and that is COVID-19 vaccines in Cameroon. We have had 2 already in circulation as at yesterday, received at the Semalene International Airport. We have already a Sinopharm, a gift from a friendly country, China. We have also had the one that was received yesterday at the Yaoundé Semalene International Airport, AstraZeneca vaccine. We have 2 already. How are they going to improve and get us out of the pandemic? That's what we'll be focusing on today. And the question we will be asking, the vaccines are voluntary. Why voluntary? We could ask it otherwise. Why not obligatory? Because the illness, the disease is what it is. You don't choose whether you will have it or you don't choose whether you will transmit it. Why not voluntary? Why not obligatory rather? But we're going to treat the question this way. Why voluntary? And to talk about this, we have 2 medical doctors here of different specialties. We have Dr. Eric Tandy, who is a public health doctor in the Ministry of Public Health. Good day. Welcome to the program, Doctor.
Yeah, good day, Killian, and thank you for having me.
Thank you for coming. You're going to enlighten Cameroonians on what is happening as concerns COVID-19. And we have another doctor here with us. He's a virologist, Dr. Joseph Fokam, virologist in the Chantal Biya International Reference Center here in Yaoundé. Welcome to the program, Doctor.
Thank you, Killian.
Honor to have you on the program. Next to you is Bertrand Do. Bertrand Do is the coordinating editor and the Median newspaper. Welcome, Bertrand.
Thanks for inviting me.
Yes, to the extreme right of the set is Emmanuel Fonban. Emmanuel Fonban is the publisher of the Astute Inc. online newspaper. Welcome to the program, sir.
Thank you, Killian. It's a pleasure to be here again.
You have the panel, able people to talk about the pandemic today at the time that we have a vaccine. But we're going, first of all, to look at what the newspaper said during the week. And our lady, Emmanuela Vemnui, is always there. This is what the newspaper said through her voice. Emmanuela.
If there is one news story that caught the eye of almost all newspapers the week ending, it would certainly be the COVID-19 vaccine in Cameroon. Cameroon Tribune headlines introduction of vaccines, an imposing choice, then passes on to a superior level with the arrival of the vaccines. The Eden writes, PM receives first batch of Chinese-donated COVID-19 vaccines. The Star adds that Cameroon has received 200,000 COVID-19 vaccine doses before Cameroon Tribune announces the start of vaccination proper. To the Guardian Post, Health Minister takes first jab of COVID-19 vaccine. The Sun reports that Health Minister gets first shot in the arm as government reinforces strategy on COVID-19 vaccination. On Cameroon Insider, government calls on Cameroonians to freely receive vaccine on the post-weekender. A call not seemingly heeded by all as Northwest records false start in COVID-19 vaccination launch as Northwest Governor Mezam SDO Bamenda City Mayor absent at the launch on the horizon. The paper also reports that the Southwest region receives 12,000 Sinopharm vaccines. Then President Paul Biya creates a task force to reorganize management of COVID-19 funds. On The Voice, a decision the Eden thinks will make heads to roll, and immediately panic grips CPDM ministers as Biya orders prop on the median. Happening when PM decries non-respect of barrier measures in markets. On the Herald Tribune, before the Minister of Public Health announces 1,000 deaths in Cameroon. The Post is saddened by a dark week for traditional institutions in Cameroon, a grim weekend for Cameroon. On The Star, a week that saw the exit of great men on the Eden, as Cameroon loses 5 icons in 48 hours. On the horizon, icons in the likes of Senator Von Mokete, Professor Gervais Mendoze, Minister Okuda, Lamido of Garwa, and the list continues. to The Voice, ostentatious deaths rock weekend. Cameroon Insider, on its part, brings to the fore political class and literary world in mourning. To Cameroon Tribune, historical political icon Mfon V.E. Mokete passes on. A glorious exit in the eyes of the Guardian Post, but municipal update is more specific. Mfon V.E. Mokete sundown at 103, the paper writes. The median mourns that Mfon V.E. Mokete was the last man standing, even as the Herald Tribune is more specific than Mfon V.E. Mokete is one of the last Anglophone icons on the Sun. Then Bia pays special tribute to Senator V.E. Mokete. The crisis in the northwest and southwest regions continue to take new twists as parliamentarians write another controversial letter to U.S. Senate before French MP urges EU to discuss Anglophone crisis on the Guardian Post. At the time, Cameroon MPs encounter international NGOs' appeal for action in solving the crisis by the U.S. on the horizon, happening when the case of trafficked 28 Indian children is sent to Boya High Court on the post-weekender. Just when UN Secretary accuses Cameroon military of rape, gross gender-based violence in northwest, southwest on the Guardian Post. At a time, B reconstructs 3 bridges in Akwaya, southwest region on Cameroon Tribune. The outright boycott of maiden visit of Jan Lobo SDO by population. The warning sounded by government on violence in the school milieu as schools resume for the 3rd term, the suspension of 2 officials of the Ministry of Public Health for corruption, and the donation by Minister Rose Mba Acha Fomondam to the Momo community also form stories reported by the papers this week. Let's now end our press review with this story on the Guardian Post, where some senators who were present at the professional honor ceremony of the fallen SDF Senator for Dongamantu Fon Dix Kumbonsi Metem Alim reportedly fought over drinks. According to the Guardian Post, the ceremony at the Chamber of Agriculture in Yaoundé had reportedly been hitch-free until during refreshments, when some senators were seen scrambling for wine and whiskey bottles served to mourners. They were caught on camera putting the stolen liquor bottles into plastic bags. Senator Awudumbaya, shocked by the act of disgrace and shame, as he termed it, is said to have been shunning such behavior from his colleagues at the top of his voice. But apparently nothing changed, as the deal had been done. Until I come your way again, this is your Hour with the Press.
Thank you very much. Thank you so much, Emanuela. You heard her in press review, the one topic that was a household discussion and in public places this week, the vaccine, COVID-19 vaccine. And we, as Cameroonians, as a country, Cameroon already have 2 with us. It is no longer hope on the horizon. It is hope already with us. The vaccines are in Cameroon, Sinopharm and AstraZeneca. The latest was received yesterday at the Nsemalene International Airport in Yaoundé. AstraZeneca, 391,000 doses, with an extra 19,000 doses in case something happens. And just last week, 200,000 Sinopharm doses were received. That makes a total of so much that Cameroonians have started having. And authorities, especially the Minister of Public Health, was the one who set the pace. He took the vaccine. But coronavirus is still a big problem with us. We're going to ask the public health doctor, Dr. Tandy Eric, what is the situation of coronavirus in Cameroon as we speak?
Yeah, thank you very much, Killian. As of now, we've passed 60,000 Cameroonians who have been infected with the coronavirus. And with much concern is the number of deaths that we've passed, 1,000 mark, that have succumbed to the virus so far. However, the situation in the country is vaccine. We need to get vaccinated. The population needs to adhere for vaccination campaign that is ongoing. The state has taken responsibility to provide these vaccines to the state, to its population. And I think what is left for the population is to take, each and every one of us has to take the responsibility to contribute in cutting the chain of this virus from circulating. And I think that is a message that the state has passed. The state has taken its responsibility. It is now for us, for you and I, for everyone to take responsibility.
We're going to take responsibility at our different levels, Doctor, but the situation is not really clear from what you have said, because by the end of December 2020, we had about 500 deaths in Cameroon. January, February, March, April, just 4. We have now about 500 deaths within a short time. How do you explain this?
Yeah, Killian, you know, with every outbreak, this is expected, especially from the onset. I should explain, you know, when coronavirus started in Cameroon, there was that fear. You know, everybody was concerned and everybody tried to adhere to the situation. Within time, as time goes on, individuals become used to, you know, especially when some barrier measures or some restrictions were relaxed. The population thought maybe they could now live with it. So we're expecting that during this period, the number of deaths that were recorded was very normal, to be low. And again, when the second variant came, you know, with the attitude for the population not being very responsible, very disciplined, they neglect the barrier measures. And with this negligence, we're expecting a jump in the number. And that is what we are seeing happening within the community. That is how it is with outbreaks, you know. But now the information we need to give the population is telling them and making them to understand that the risk is still high. And we are seeing it due to negligence. Within 3-4 months, we are able to double something that we try to sustain within a year, you know. So right now, what is important is we keep communicating, we keep calling each and every one of us to be disciplined so that we could cut the chain.
What about people who say the figures that have doubled or even more than doubled in terms of the number of cases and the number of deaths, of course, is because of more testing and probably more declaration of deaths? That people were still dying, but this time more testings lead to more figures.
Yeah, you know, with the coming of the second wave, I must say, more sensitization was done, more coordination was done, more tests kits were provided within the communities, and people are there based on what they've been noticing within their communities. I think people have seen people falling, you know, dying and being even admitted. Remember, from the beginning, there was a lot of hesitation. People were doubting. But with time, almost everyone has been touched because we've had community infections, you know, and it's very much visible now within our communities. So the population decided as well to adhere to information and go in for testing.
Dr. Joseph Fokam, virologist, this virus we're talking about, you're a virologist. Why is it behaving this way?
Yes, thank you, Killian. I think locally, Dr. Tandy has really given us the public health implication of COVID-19 actually within our context. Maybe just to add a bit on what he said, and he highly mentioned it, Cameroon during our first wave of COVID-19, we had our maximum peak at 2,028 cases within a week. Actually, within this second wave, we have seen just some past week ago a maximum of 5,914 cases about within a week, which means we have tripled our numbers of new infection within a week during this second wave as compared to the first wave. So we already have reasons about the slowing down of barrier measures, and also and also those not practicing those barrier measures within the community. But there is also one important factor in terms of the virus itself. In Cameroon also, during the first wave, we did some sequencing within our pathogen genomic working group, and then we realized we had just the original variant of coronavirus. So the first variant, that was in December. Actually, in January, March, up to this early April, we are now seeing some cases of new variants. For example, we have the strain from South Africa, the N105Y-V2, which is a major variant of concern that we are seeing already in Cameroon. We have also seen some cases of the British variant also within our context. And based on these two recent discovered variants in Cameroon, that we know they are very aggressive, they are highly transmissible, they have like 60 to 70% more transmissibility power as compared to the original variants. So if in our community people keep on with the low rate of adherence to barrier measures, with a more transmissible virus, it is just obvious that we have tripled our numbers. And in this context, we cannot just stay with our traditional preventive measures, washing of hands, physical distancing, and wearing of face masks. We need an additional tool, and this is vaccine.
And
vaccine,
it has come.
And it has come, so we really want now everybody to adhere to it.
You have talked about the two variants, the South African variant, the British variant that has come to add to the traditional coronavirus, making things difficult for us. Are the symptoms different or they are the same as the traditional coronavirus symptoms?
Actually, the symptoms are quite similar. The symptoms are very similar. And maybe what we can also add is that we have been seeing this in the laboratory. For example, at the Chantabia International Reference Center, we are noticing some changes in the virus in terms of their target for those who may have the variants and those who have the original virus strains. Then also what we see with the new variants also is, in terms of diagnosis, the diagnostics tool we have in Cameroon is able to pick up both the original and the new variant, which is a good news. But what we have also noticed, like a change in the virus, people with these new virus strains or during this second wave, they tend to have a longer infection period.
The new one?
The new one. They tend to be positive for like 4 weeks, even up to 8 weeks. They might no more have symptoms, but you will find them from time to time with tiredness, some kind of dizziness. So this new virus strain seems to be coming with some further complication that we really need to study further. And the very last issue that we also observe is some people appear to be asymptomatic with this new virus strain, but when you go in depth, doing like a medical imaging, then you realize the lung is being affected. And that's why we really want everyone, if you have any similar symptom with coronavirus, it may also be like a malaria symptom, please get tested as soon as possible. The earlier you get tested, the better the management, and we are going to reduce this troublesome number of deaths that we are seeing in the community.
You've talked about the longer duration for the new variants. What about the incubation period of the new variants?
Yes, the incubation period, which basically means the time during which the virus replicates and start causing disease in a human, it stays more or less similar. It's between 2 to 14 days with a median around 5 to 6 days. So if somebody actually, in the current situation, you have a contact with a positive case and you have been around 5 days after this contact, then it is the right time to get tested. And this is a very important question. Why? Because we see people who go out for festivities on Saturday, and then they realize they were in contact with a positive case during that Saturday, and they want to get tested on Monday. It's too early. And sometimes they tend to accuse the lab that I had a negative result earlier, then after my result was positive. And people tend to believe more in the negative result. So we really want people to have this change in the paradigm. You might be purely asymptomatic, even with this second variant. You might have no symptom, but you are highly transmissible. And within our community, actually, we know we have many people who have some comorbidities. We also have our parents who are like the elderly. Once they get this virus, then it will be very difficult for them to come out of it.
Now, you've talked of somebody who gets sick during a ceremony on Saturday, and on Monday they are tested positive because the virus has not yet shown itself. So what do you advise then when somebody notices that they got in contact with a case?
Yes, so what we really advise actually, if you have been in contact with any confirmed case of COVID-19, please wait beyond 2 days and ideally around 4 to 5 days to get tested. If you get tested during that period and the test is negative, please, it doesn't mean you are fully out of coronavirus, because this incubation period might go up to 2 weeks. So please listen to yourself, be honest with yourself. If you have any symptom, don't hesitate, because the cases of mortality that Dr. Tandy just mentioned, they are true cases. And why do we have them? Why do we have them? It's basically because people turn up very late at the health facility. And when they come up very late, what happens is the lungs have been seriously affected, about 50 to 70% pneumopathy. And they just want us to confirm that they are dying.
Doctor, one last question. You make it frightful. We are used to malaria. In every household, we know that 1 or 2 days somebody will rush to the hospital or rush to a pharmacy, for those who know, get treatment for symptoms of malaria or just some light fevers. What you doctors are saying now is that we should forget about common malaria and go for COVID-19 tests, coronavirus tests.
I think that's not the case. And I mean, I won't be afraid to take my personal example. I was a COVID-19 patient as well. And you know, you invited me, but I was sick, so I couldn't show up. So what happened is I was working throughout that week. I had a lot of tiredness. I was quite tired. So I thought maybe it is burnout due to COVID-19 emergency. We are testing many people every day. We spend time at the hospital. Then 2-3 days thereafter, I also realized I have a kind of slight headache. Then I also realized in the evening there was a slight fever. After I have taken paracetamol, the headache went down. Then I saw the fever was like persisting. I got tested just with the rapid testing, and it was positive. So we really want everybody within this area of the second wave, where Yaoundé is like around 30 to 50% exposed.
That's why Yaoundé has the highest number in country. That's the central region.
Exactly.
And directly also Yaoundé has the highest number in the country. Bertrand, yes, just add before I go to the media people around.
Okay, thank you very much. Just like Dr. Fokam has rightly said, we have to be very, very careful as far as this second wave is concerned. And again, the concern about testing within a number of days. I've seen people celebrating negative results. This is not like HIV testing where it takes a longer time. But remember, this is just for 3 days. And once you have 72 hours, referring to 3 days, if you notice any sign, please. We are not scaring people. We are not kind of stigmatizing people here. We're simply communicating information that is right and clear. Go in for your normal checkup within health facility. And you know what the state has done now is multiplying testing centers with the rapid diagnostic test. And I guess within the national territory, all health districts now have a testing center. So it is very important for the population to move to a health facility. Health personnel have been reinforced to understand how to do this kind of diagnosis with patients that come up with complaints. You know, is now becoming a basic or a screening tool for any other pathology when you get to a health facility. Unfortunately, the method of collection of sample is not as complicated with certain analysis. So it's just a simple nasal swab and you have your results, but do not celebrate. I want to say it here clearly that you should not celebrate a negative COVID-19 results, but rather keep safe and respect barrier measures, because within 72 or 3 days, you might test positive.
Thank you very much. Doctor, you say simple nasal swab. I'm telling you, I have not seen anybody who has come out from that simple nasal swab and has stayed quiet. When you come out of that place, you are not yourself. You feel, I don't know how to describe how you feel. Tears run down your eyes. You feel everything not fine. Well, but it is advised to do that. And exactly the hope now, we talked about early, is that we have the vaccine. And I think the one solution, you agree with me, it's out of COVID-19, is a vaccination. And we are happy we have the vaccination. We may come out of that. And you are going to tell us why make it voluntary. But before we enter into that discussion. I'm going to ask these two gentlemen on the extreme sides of the set, Bertrand and Emmanuel. You've listened to the doctors. Your preoccupations on this topic?
I think after following Dr. Fokam, I feel frightened because, it appears that the coronavirus is becoming more complex. It's coming up with more complexities to, the global scientific community, showing up different variants, and which shows that, the population really has to adhere to barrier measures because the complications are coming up every day. But I will equally want to appreciate the work they are doing because, they have been at the fore giving out useful information to the population. But now the problem is, the coming of the vaccine, we are in a country of close to 25 million people. We don't know when the last census was done. I think this population must have increased. We have crossed the 1,000 death, and many complications are coming up. The different variants are coming up. Now, we are targeting, when you follow the Minister of Public Health, he said we are targeting 20% vaccination. And he made mention of the fact that we have received 200,000 doses Sinopharm. We've received, during the interministerial press conference within the week, he talked about 1.7 million doses of AstraZeneca. This is a controversial coronavirus vaccine. It has been rejected by some countries because of health complications related to blood clots. Now, the scientific community, the medical council, first of all, rejected this vaccine. Now, it is coming up. About 391,000 doses were brought in yesterday. Now, the communication has to be improved for people to believe in the efficacy of the AstraZeneca vaccine because it was suspended by the scientific community for precautionary reasons and for more, they wanted to do more monitoring on how the vaccine is going to be. So, but if you look at the way Cameroonians have welcomed this Sinopharm vaccine, we've seen many people vaccinated, not just the health personnel, we've seen regional governors, we've seen even journalists.
Some members of the population.
The population. We've even seen journalists taking the vaccine. About 3 journalists have taken, one in the private sector and one with 2 with CRTV. I think it's encouraging. But now, my problem is this AstraZeneca that has been brought in. And then we are hoping to receive 4 million doses of the Johnson & Johnson as announced by the Minister of Public Health. But these are vaccines that have been rejected even by South Africa. Before
the doctors come in, let me ask you, in the communities you are talking about, we follow that information ourselves. In some countries where they say they should wait, not that they should not take suspension.
They are suspending.
The same countries, in each of the countries, they are divided. There are people who are saying take the still of the medical corps. So they are saying that take.
That's what we're saying. Because the coronavirus is bringing a lot of headache to the scientific community.
This is what they say. That when you look at the few people whose blood got clot after taking it, and then you look at the people who have gone normal and got out of coronavirus after taking the vaccine, you wear the two. You will go in for the virus because people are dying. That's we are following that information ourselves. Without saying what you are saying.
People are dying, but you have to understand that the countries that are suspending to have different variants. He talked about the new variant in Britain and the one that is coming up in South Africa. The Johnson & Johnson vaccine clinical test was run in South Africa before they started it. Now it has been suspended because of complications.
Well, we don't have Johnson & Johnson yet. We have...
the minister is talking about 4 million doses to be brought in.
Because it is still running, for what I know, while the drug controls, international and national, are going on. People should make projections to get in when it is finalized. Let the two doctors address your issue, and I go to Emmanuel.
Okay,
address his issue.
Okay, thank you very much. I think we should not get distracted here with observational studies or on social media issues. Let us be very, very clear. Before coming to that point, I think we should appreciate the state of Cameroon for having taken into consideration the different variants that are circulating in the world and that also are present within our community, and we might still have more, and have gone in for multiple vaccines. And these multiple vaccines target entirely the variants that are existing, So that is what the state is doing for the population. About AstraZeneca that you've complained about is but normal. That once any vaccine that is launched within the system that is new, and we expect to see, and it will still happen, when once this kind of things happen, like clotting, like it was dictated in certain individuals that took it, further analysis were done, and after this analysis, the state of Cameroon first of all suspended to follow up what was actually happening, after the observational and thorough investigation that was done in countries that have been taking it. They discovered that the platelet count, because platelet is what accounts for clotting in individuals, of these individuals had issues and had nothing related to the vaccine. That is why you've seen AstraZeneca being vaccinated in the UK and even other countries, and it has proven very, very effective. Don't forget that in public health and in even any other issues, it's not everybody in Cameroon that takes paracetamol, that is widely consumed. There is always a zero margin. There's always a margin. In public health, we even go as far as 15 to 20% of this. But what has happened with AstraZeneca vaccine within areas where side effects have been reported or consequences was not even up to 1%, among the population that was vaccinated. Those are some of the indicators that we take to measure the efficacy of any medication or any vaccine that is injected within the population at wide. So what the population of Cameroon should be concerned about is that what was the percentage and what were the results of these studies that were done? And again, to remind that the state of Cameroon cannot go in for something that is not good for the population.
Yeah, I think they have taken step up.
Yes, and we're doing a lot on that. We're talking about that, and the ministers and all the spokesman of the state communicated on this last weekend. And these are the points that we have to make very clear.
He is making a point, Doctor, that communication is not
because these observations have not been made known to Cameroonians.
Yes, people should know so that they scare the fear of the vaccine and some other things around the disease, or the virus and the disease. Well, people don't have them. Do we actually know? People don't know what our National Drug Control Center, we call it CINAMI, I think that's what it is. Do they communicate after, like you said, they said, okay, we're going to investigate into it. They just bring the vaccines without coming out to say, okay, we investigated, we cross-checked, and then this is what we have discovered, what is coming. Please don't be afraid. It does not done. That's his concern.
Yes, I want to agree with Bertrand that communication has not been at a wide range. But let me make it clear here that the EPI department and the Ministry of Health, in collaboration with other sectors, have been working for the past 2 weeks without rest to come up with a clear communication plan as far as vaccination is concerned. Even speaking right now in Bankomo, they are finalizing this strategy for a team to go down to the field beginning from tomorrow, to actually communicate on that. And one of the public health strategy that has been used is that we're integrating from bottom to top, meaning all community leaders within the community, just like we're communicating on barrier measures, they will also take the lead to give clear and precise information, as far as this vaccine is concerned. And what to do in case of any abnormality that you observe, you have to get to these persons and all this information.
Thank you. As you have said, they are yet to go down to the field. That's what is concerned, that they should go down to the field.
To reinforce. They are reinforcing what has already been communicated. Not that is completely out.
Emma, it is really interesting. You are coming in now. You have been listening. You must have had some concerns.
Yeah, Kilian, I think that the first concern that I have is that it's rather unfortunate that at every point in time something like this is coming up. We'll always have experts who are not there to invent but to test the soup and tell us if it's nice or it's not nice, and so on and so forth. And it's quite unfortunate that we have experts who have only been used to transmitting information that is prepared by those who produce, by those who cook, and this same information is just what is given down to the people on the road.
Yeah,
I don't know with all the intellectual.
You don't seem to be very clear in your analogy.
Yes, maybe I'm coming down now. I think I don't understand why, with all the intellectual resources here, we are here with two medical doctors who are experts, I guess.
Public health
there are
and
many,
virologists.
absolutely, and there are many who are experts in medicine. We've seen, it is not today we are saying coronavirus. I don't know if we had to wait for somebody somewhere to make a vaccine for us to start debating if it's good or bad, or there is actually something lacking, because we have schools and we promise ourselves that these schools are going to train professionals for us who are supposed to be problem solvers to every problems that we have. And most often when issues come like this, we don't see these professionals take the opportunity to actually do what they are supposed to be doing as professionals.
Okay, we're going to take it up. Do you accept that a vaccine, when we talk about vaccine, well, I'm not a medical doctor, yeah. Emma, it's a very complicated thing to do. It takes time. It goes through countries. It's not about one country. Do we accept that? I
very much agree with you, and we are not very limited. We are not limited. I think that we have the capacity to also come up with what suits our population. Because when you look at most of these vaccines, the samples that are used to actually test on the efficacy of the vaccines, they are actually collected from the countries that these vaccines are made. And I don't know, I feel that somehow people in different parts of the world, somehow they have different ways they respond to chemicals that are used in fabricating these vaccines. Meaning that they should somehow be, they should somehow they will not somehow be as efficient with us as they could be efficient with within the population. I don't know if our doctors can.
Yeah, they will.
Kilian, he talks about having I think we have the manpower to produce vaccine and other things, but do we have the technology to do this? Because you discover that our Ministry of Scientific Research and Innovation has done basically very little from the start of this virus. When the issue of chloroquine came up as maybe a remedy, the minister, Dr. Madeleine Trentes, came up and said that we had all what it takes to produce chloroquine, but for the raw material. And communication has been like, at this point, we don't even know if a single tablet of chloroquine has been produced in the country. Talk less of doing a vaccine.
I went to the lab and I actually saw tablets produced.
Is the ministry communicating on this? That is a problem. But now I want to come in now from what the Prime Minister said when he chaired the March session of the March cabinet meeting. He talked about Cameroonians accelerating efforts towards developing applied science. We have to create our own remedy. Now we at the start of this virus, at the first wave of COVID-19, the plant-based remedy of the Archbishop of Douala was at the peak. It has cured close to 5,000 people. But now nobody is talking anything about this. Government has been mentioning, the synergy between traditional medical practitioners and the scientific community. But now it seems everybody is driving towards the vaccine.
Supported the Archbishop
at the beginning, and where are we now?
Actually supported, it's not like government did not. Government supported. We mean that government has been inclusive for what I know.
The synergy has to continue for us to
but you are raising a very important issue.
Nobody said anything about clear.
That will ask Dr. Joseph Forkham, who is a virologist. Are you sleeping? As people who study the virus, behavior of virus, and probably come up with what can attack and kill the viruses.
Thank you so much, Kilian. I mean, I'm very happy with the questions that have been raised because it's also what we have at community level. And most of these issues also come up from the social media, which seems to be overshadowing the scientific evidence that we have out there. What I really want to mention, I was talking with Dr. Tandy at around 3 a.m. this night. We have not been sleeping. We spend the night working in the laboratories, working at the Public Health Emergency Center to make sure we are really monitoring this viral strain at country level. And one important fact that we need to know, COVID-19 is still an emergency. And in a situation of emergency, we try to manage as quick as possible with what we have.
Global emergency.
Global emergency. And what do we have like an acceptable range for vaccine efficacy in case of emergency like COVID-19? Once a vaccine has a 50% efficacy for a case of COVID-19 emergency, then it is acceptable globally, because it means you'll be saving 1 out of 2 that might be exposed or that might be infected or that might suffer of the disease. Yes. And among the 4 vaccines that Cameroon have selected for the moment, all these 4 vaccines are above this 50% efficacy. So, and this is why Cameroon has really tailored their vaccine within this range. And for example, the AstraZeneca vaccine, the Johnson & Johnson vaccine, that have some similar principles, have already been authorized by WHO for emergency use authorization. The Sinopharm vaccine is also at the final stage for WHO authorization. It's just paperwork. And why? Because since March, they were supposed to do this, but probably due to this emergency issue, they are taking some time. So Cameroon is picking up the best that we have out there, like vaccine. And why again? Because there is this issue of viral strain. There is the issue of South Africa variants that seem not to be effective with the AstraZeneca vaccine. This is true. And we even have an Africa CDC statement on this. Africa CDC is Africa Center for Disease Control and Prevention. They have issued out a statement to all state members of the African Union. And they clearly mention it. South Africa has suspended the AstraZeneca vaccine for one reason. There they have above 50% circulation of the South African strain, which is not adapted to this vaccine. So it makes sense. In the contrary, in Cameroon, as I mentioned earlier, we have seen some very few cases.
South African
cases of South African strains, which means that in our context, public health-wise, the AstraZeneca vaccine is going to be effective.
Okay, that clarification is there. Yeah, I think, yes.
Mr. Anda, I think there is one issue which I still have. We know Cameroon should be above 25 million, and the doses are quite very limited. I think that they cannot even fit to 1/4 of the population. So we don't know the priorities of the government.
I was at the airport yesterday where the minister... Yes, no, I would even speak for that. We don't have so much time. I was AstraZeneca was received by government, and the Minister of Public Health, the World Health Organization representative who was there, the Japanese ambassador to Cameroon who was there, the U.S. ambassador to Cameroon, and a host of other officials who were there, making it official. They said that was just the beginning, that much more is in the pipeline to come and boost it up. I was there. It's not now, why I clarify that is because we'll not be debating on that. We have so many other issues to say. Our topic is COVID-19 vaccine. Why voluntary? Why make it voluntary? We're actually going to talk about that now. You see why I had to clear that for us to talk about it. We know the danger from what we have explained. You have COVID. You go out there. You don't even know. You spread it to so many people. People can give you. You don't choose to have it. You cannot escape because you will not stay at home. When a vaccine, like the only solution, the only cure comes, doctor, you, Dr. Tandy, Dr. Fonka, why do we make it voluntary?
Good. Why do we make it voluntary? I think there are some experts in the field of public health who might rightly explain that. But now from a virological point of view, why do we make it voluntary, and why do we make it essentially a stepwise process? Stepwise process, it means we are trying to use a cost-effective approach for COVID-19 vaccine in Cameroon. One, we are looking at those who are more exposed.
Cost-effective means?
Cost-effective means we want to use this vaccine for those who need it at most in the first stage, then we'll be going gradually. And at the very first stage, we have those who are really at the front line. And believe me, Kilian, yesterday I received more than 300 samples from people who need COVID-19 test. And just among travelers, we had like 29 to 30% positivity. These are people coming just for their trip. They are more or less asymptomatic, but among them they have positive cases. And they keep on transmitting the virus in the community unknowingly. Dr. Eric Tanji and myself with other colleagues, we are in touch with these people on a daily basis. So we need to first protect those who are protecting our people in the community, which are also the doctors and the nurses and the pharmacists and other line. So this is why in Cameroon, if we really want to combat COVID-19, let's first protect those who are on the front line. Secondly, now, we also have the elderly, those who are like 50 years and above. Elderly age also comes with comorbidities. Elderly age also comes with poor immunity, with high risks of other infection, other diseases. So we want to protect those people who are more vulnerable. And because in Cameroon also those who are dying more after contracting COVID-19, there are those with this advanced age. So this is a stepwise approach. And then we'll be going further to the entire population in Cameroon. And believe me, I went for my COVID-19 vaccine. This was on Thursday. I mean, this is my vaccination card. I got it. And after I received this vaccine, I took some time to observe around. I didn't see anybody who came for the vaccine and was chased away. Nobody. Everybody who was there was vaccinated. So why don't we go for this vaccination? Why don't we protect ourselves and protect our family and our community?
Thank you. The message is there.
Yes.
Just go. You will not be chased away.
Kilian.
Why voluntary?
Yes.
That is the question.
I think we should be very clear here. We are functioning in a state and in a democratic state, you know. This is not a dictator system. The head of state understand the will of the population, understand the need of the population. What is important first is to bring the vaccine to the population and now allow the population to take their engagement and responsibility, you know. It's not a matter of issue of mandating everyone to go for the vaccine, but want to see how the population of Cameroon is taking their engagement, because the head of state has not met it in a way that he is obliging everybody to take it. Dr. Fokam has rightly explained.
The problem here, Doctor,
yes.
The problem here, head of state or no head of state,
yes,
or is our head of state.
Yes.
You involuntarily transmit this virus that leads to death.
Yes.
Some people may even do it voluntarily, we are told. You go out there and you get it. You cannot help if you go out. And since nobody will stay at home, what will you eat? People must go around. What will you use? People must go around. It's a virus of its own kind. You, the medics, you have told us. You don't choose to get it. You don't choose to transmit it. Sometimes without knowing. Why not make it obligatory at a certain level, at least for some people? Now we know you before you traveled, when we didn't have any vaccine yet, you had to show proof of a negative test. That was not voluntary. That was obligatory. Now we have a vaccine, which is even so many steps ahead of, say, it's the cure, it's the magic one. Why not coerce people to take and save themselves and save others?
Yes, Kilian, I want to agree with you. When you make a statement that is going to be mandatory for everyone, let me tell you, there are underlying factors that will keep some people out of it, you know. That is why it's made voluntary, because there are preconditions that have to be evaluated. Dr. Fokam has rightly said that there are comorbidities in some individuals. So when you make it mandatory, it's like everybody, irrespective of your condition, you have to go in for the vaccine. That is not the message here. The message here is simple and clear, that those who are interested to take the vaccine, normally at one point, we are just at the beginning stage. At one point, we'll come to a situation that almost everybody has taken it. You rightly said that before you travel, before you travel out of the country, you have to show proof of a negative result. It would come to a time where you need to use certain services. You have to show proof that you've equally been vaccinated, you see. So at this point, it is a gradual process. Remember, with COVID-19, nobody can claim a complete 100% understanding. We can't be speaking now, and in the nearest days to come, you have another variant that is different, that needs to change all the vaccines that we are taking now. What will we do? You see? So it is a gradual process with gradual decision making, and the state of Cameroon is monitoring all this with very keen interest to protect its population. Please, it is not a matter of giving it or making it mandatory.
Thank you. Dr. Fokam Joseph, from what Dr. Tandy is saying, we understand the state is taking its responsibility to make sure that citizens are safe. Still talking about this vaccine, we follow some international channels from some places, analysis on the vaccine, and we are told that the vaccine is not in the person who takes forever. That only protects the person, I don't know what I say, for some time, maybe 6 months.
Yeah.
Then what happens if COVID is still there?
Killian, this is true. And I think we need to communicate accurately what is happening. For now, be it in the US, in Europe, in Asia, or in Africa, what we know about COVID-19 vaccine efficacy is that it can protect up to 6 months. Then we have clear evidence. But it doesn't mean it is only 6 month protection. It's because in the current study that has been done, we have a maximum of 6 month follow-up. We believe it may go beyond 6 months. We are pretty sure of this. It may go beyond 6 months, but we can't really tell exactly up to when. Yes. So as I'm saying, even in the US, this is what we have like evidence. In Europe, same. Now, coming back to Cameroon, it's always nice to contextualize what we have within our context. Cameroon actually has been undergoing COVID-19 vaccination campaign. And what we have observed so far, there have been no serious adverse events. Mm-hmm. We have already vaccinated beyond 2,000 people. And in all the 10 regions of Cameroon, we have already had a kickoff. We haven't heard about any severe adverse event, which is already a very good news.
Yeah, very good indeed. But we are told that the adverse effects, some of them don't come immediately. And we read, we watch, we hear that this vaccine could lead to DNA modification. What do you say?
Effectively, the vaccine that could lead to DNA modification is the Pfizer-BioNTech vaccine, which we don't have in our 4 preferred vaccine choice. And why don't we have this? It's not really because of this issue of DNA modification, because that has been proven that there seems not to be a clear evidence on that. Mm-hmm. It is mainly because of logistics. The Pfizer and BioNTech vaccine requires a -70-degree freezer for conservation, which we don't have at country level. So we can't go for something that might be effective in Europe and in America, but only based on our logistics and temperature. It won't work in our context. So we don't want to give to our population what will not really protect them. Now, coming back to what we have selected as vaccine in Cameroon, those 4 main vaccine.
Yeah, the 4, we have Sinopharm, we have AstraZeneca, we have Sputnik 5, and Johnson & Johnson.
Yes. Among those 4 vaccines, 2, as I said, have already received WHO authorization for emergency use. Sinopharm is also at the final stage, same like the Sputnik vaccine. Now, among these 4 vaccines, we have heard about 2. Dr. Tandy mentioned them. The AstraZeneca and the Johnson & Johnson vaccine, that seems to have some issue with thrombosis. Mm-hmm. And actually, they are very rare events. Imagine, Killian, this is 6 out of 6.8 million people vaccinated. So less than 0.0001% that we are talking about. So it is not yet proven that this is quite tied to the vaccination process itself. So it might be just unforeseen event, which needs to be proven at the end of it. Why the Sinopharm and the other vaccine from the Sputnik, they haven't really seen any such event in those vaccines. So we believe our scientific council in Cameroon have chosen the best vaccine for the population. And maybe just to end up with this topic, Killian. In the Western world, what they do is the first vaccine you get is the best. You shouldn't delay. And why? Because the earlier we vaccinate, the earlier we stop the circulation of the virus. And once we stop the viral circulation, we will also stop the emergence of new variants. Because the more the virus keeps circulating, it replicates, the more we have new variants. And maybe we may end up developing Cameroonian variants if Cameroonians do not adhere to this vaccination.
God forbid, we don't want to get there. Yes, Bertrand.
Just to add to what he just said, you asked a question that some of these side effects have to go for quite a while. But let me say, the communication plan, the strategy that has been put in place is that there is monitoring right up to 45 days. Okay. If after taking the vaccine you observe any of these signs, simply go to where you took the vaccine or communicate to that center if you cannot get there, and they will come to your assistance.
Now, this is a question I asked to the WHO representative in Cameroon yesterday. I want to ask you, because you are of the core. We know that those who are giving, Cameroon has promised that they will give us enough vaccines. We have the 3 others, except for Johnson & Johnson, that is 1 dose, I suppose.
Yes.
The 3 others is 2 doses, yes, for you to have it complete, 21 days, that about.
Yes.
What if you take the first dose of 1, and in the 21 days time, you don't have that one? What I hear they call it mixed match. How do you manage that?
Okay, let me explain very clearly on that. The vaccination strategy that has been put in place take into account for number of persons projected to be vaccinated. And this number and what has been received is taken into consideration. For example, when we receive 200,000 of doses of Sinopharm, we're going to vaccinate 100,000 persons.
Exactly.
Because, or less than, a little bit less than, because there will be some wastages. So we'll vaccinate about 90,000 population and a little bit above, and then reserve the other 90,000 after 21 days to avoid any issue of shortages.
Thank you.
So there should be no worry about...
That's clear. Yes, Emma, we're moving out. You got that?
Mm-hmm. Yes, Kilian, I think it would not be fair if I leave here without mentioning this issue. We used to know mafia to be in other sectors and not the medical sector. I think that it's going to take us a lot of morality to be able to make sure that our health personnel are actually
very sincere,
justifying, being very sincere with what is happening. Because you know the issue with the yellow fever that people have been using to travel, how some people go pay money and then they don't even get the vaccine itself, and then they just fill the form and then
declared negative.
No, there's a lot of desperation with people who want to travel, and I tell you, there are people who can go extra miles when they are declared positive. Because they know if they have a positive card, definitely...
We got that point, is important. Doctor, and a very swift answer to that, 30 seconds.
Yes, I think a database has been created. Measures have been taken in order to not have anything like fraud. And the cards that have been issued after vaccination have codes, specific codes. We can verify that directly, and information is given to us.
Yes,
just like with the COVID-19 test as well.
Yes, we got that. Dr. Fokam has his card here,
yes,
vaccination card. Is there a code on this card?
Yeah, of course.
Yes.
They should.
Yes, of course there is a code on this card. And we really want every
Cameroonian...
visible? It's quite visible, yes, the code.
Oh, okay.
And we really want every Cameroonian to understand this. Us, the scientists, we have taken the vaccine. So we will never play mafia on our own self, 1. Secondly, Cameroon is undergoing a difficult moment with COVID-19. We have moved from 2,000 peaks to 6,000 peaks.
Yes.
We don't want this to happen again. Cameroonians are actually adhering gradually to the COVID-19 vaccine because they have seen us at the front line taking the vaccine. So if we want to avoid a third wave, please, let's adhere to vaccination.
Thank you. That message has gone across. Bertrand, your last word.
I think the last word is that we have to change the mindsets. We have to move out from stereotypes and take the vaccine. And it should not be made compulsory, because when you make it compulsory, it's going to look suspicious. So there should just be a synergy between what our traditional medical practitioners are doing and what the scientific
Thank you very much. Thank you, Bertrand Do, the coordinating editor of the media newspaper. Thank you very much so much for coming. Dr. Joseph Foncam, virologist of the Chantabia International Reference Center. Thank you, Dr. Tandy Eric, a public health doctor from the Ministry of Public Health. Emmanuel Fonban is the publisher of the Astute Link. Thank you very much, gentlemen, for coming. Thank you for watching. Take next appointment next week, Sunday, 12:30. But if you missed out on this program, you can watch a rebroadcast Monday between 2:30 and 3. Thanks for watching once again. Nice day.
CRTV News, ici, toute l'info.